In this video, we will discuss about the pneumonia in children. Pneumonia is defined as infection in the lung parenchyma. So it means when your lung parenchyma is infected by some specific organisms. So we can classify pneumonia according to its source of infection. It is classified into community acquired pneumonia. It means the pneumonia is acquired in the community. Hospital acquired pneumonia, it means the pneumonia is acquired during the hospital admission. And pneumonia in some special situations like aspiration pneumonia or pneumonia in immunocompromised person. So what are the organisms that are responsible for pneumonia? For community acquired pneumonia, the most common organisms are Streptococcus pneumoniae and Haemophilus influenzae. For hospital acquired pneumonia, the most common organism is E. coli. The other organisms are Pseudomonas, Klebsiella pneumoniae, Staphylococcus aureus, or some anaerobic organisms. And there are some organisms that causes pneumonia in immunocompromised persons. These organisms are Pneumocystitis carinii, Aspergillus fumigates. These are the organisms that mainly causes infection in immunocompromised persons. Now, moving on to the symptoms of pneumonia. So, what are the symptoms that is children with pneumonia will present? There will be fever and cough. The fever will be moderate to high level fever, and the child will have cough. And then the child will also have some respiratory distress, the chest pain may be present, and in severe respiratory distress, the child will be unable to drink or feed. So these are the symptoms that a child with pneumonia will usually present. So what are the signs that we can see in that child? Number one, the child will be dyspneic. Dyspneic means the child will be in difficulty in breathing. Then the child will be maybe cyanosed. Cyanosed means bluish coloration of the skin and mucous membranes. So the child will look bluish. Then there may be head nodding, means that forward or backward movement of the head may be there during inspiration and expiration. This is called head nodding. There will be grunting. Grunting means there is a hard sound the child causes during expiration. It occurs due to the child wants to hold the air and keep the lung open. It's caused by respiratory distress actually. So these are the signs we can see in children with pneumonia. Okay, now we'll classify pneumonia according to its severity. It is classified into two types: severe pneumonia and pneumonia. Severe pneumonia means it is severe condition, and pneumonia means it's pneumonia but not severe. So now how will we differentiate between severe pneumonia and pneumonia? So there are some criteria. For severe pneumonia, there are three criteria, and any one of them present, we will call it severe pneumonia. So what are the criteria? Number one, presence of general danger sign. There are 4 general danger signs, and presence of any one of the general danger sign, it is called presence of general danger sign. So what are the general danger signs actually? The general danger signs are convulsion. Number one, convulsion or a history of convulsion. Number two, the child unable to drink or breastfeed. Number three, lethargic or unconsciousness. And number four, vomits everything. Whatever the child takes, it vomits actually. So they are the general danger sign, any one of the general danger sign. And number two criteria for severe pneumonia is actually stridor in calm condition. So what is stridor? Stridor is defined as a harsh sound during inspiration of the child. So if the child in calm condition is producing harsh sound during inspiration, this is number two criteria for severe pneumonia. And number three, number three is actually that oxygen saturation, percentage saturation of oxygen is less than 90% actually. So there are three criteria, any one of the three present, we'll call it severe pneumonia. Okay, so here are the threes. And now what is for pneumonia actually? In pneumonia, none of these three criteria will be present. There will be two, any one of the two criteria. What are the two criteria for pneumonia? Number one, actually chest indrawing. So what is chest indrawing? Chest indrawing actually means inward movement of the lower chest wall. So there's a picture you can see. There's inward movement of the lower chest wall. We will call it chest indrawing. And number two, fast breathing. So fast breathing means that rate of breathing is increased in the child. This is called fast breathing. So how we'll determine the fast breathing? So you have to calculate the respiratory rate in case of children less than 2 months. We'll call it fast breathing when the breath is 60 breaths per minute or more than that. In case of the children from 2 months up to 11 months, we'll call it fast breathing if the respiratory rate or there is 50 breaths per minute or more than that. In the children from 12 months to 5 years of age, we'll call it fast breathing if it is 40 breaths per minute or more. So what are the investigations that we may do in case of pneumonia? The investigations, the most important investigation here is actually the chest x-ray. The chest x-ray may reveal consolidation or pleural effusion as a complication. The number two investigation is the white blood cell count. The white blood cell count will be increased with neutrophil predominance. So there will be neutrophilia, increased count of neutrophil. Then we can do the arterial blood gas analysis, and it will actually reveal hypoxemia. It may reveal hypoxemia. Okay, reduced oxygen saturation, and we can do actually a blood culture, or we can do some lung aspirate culture and sensitivity test to find out the organism actually, or the isolate the organism. So this is the four investigations we may do in case of pneumonia. Okay, and now moving forward to the treatment of pneumonia. So we will treat pneumonia based on its severity. So we previously classified the pneumonia into two types of pneumonia according to its severity actually. The one was the severe pneumonia and another one was the actually only pneumonia. Okay, so the treatment protocol will follow this classification. Okay, the number one thing, in case of children from 0 to 2 months, the children must be hospitalized irrespective of the severity. So whether it is pneumonia or severe pneumonia, if the child is less than 2 months, it must be hospitalized, and the treatment will be given by antibiotic therapy and supportive treatments, but the child must be hospitalized. Now moving forward to 2 months to 5 years children. Now there we will treat according to the severity. If it is only pneumonia, no severity found. Okay, so now if in case of only pneumonia, the treatment will be with antibiotic therapy, like we will use oral amoxicillin for 5 days. And then if the children has wheezing, we will use salbutamol for 5 days. In that 5 days, if the wheeze is gone, we will still use salbutamol for the full course. Okay, and we will explain the mother that when to return immediately. Okay, and we will go for a follow-up for the child after 3 days of the initial treatment. And if the cough continues after 14 days or there is recurrent wheezing, we will refer the child for assessment of bronchial asthma or tuberculosis. So this is the treatment protocol in case of pneumonia. And there is a different treatment protocol for severe pneumonia. So for severe pneumonia in childs from 2 months to 5 years, the treatment protocol is number one, the child must be hospitalized, and in the hospital there will be some antibiotic therapy will be given to the child, and the common antibiotic therapy is 2 injections given for 5 days this injection ampicillin and injection gentamicin. If there is no response after that, after this antibiotic therapy, these antibiotics will be within 48 hours. If there is no response within 48 hours, these antibiotics will be replaced by injection ceftriaxone or injection cefotaxime. And if there is after that 5 days, if the child improves, you may move to oral ampicillin. Okay, so this is the treatment protocol in case of severe pneumonia, and this is the antibiotic therapy. And then you have also some supportive therapies like oxygenation in the child. Then you go for intravenous fluid. Okay, you manage the airway. There is hydration of the child, nutrition to the child. So these are the supportive measures. Okay, so this is all about the treatment protocol of pneumonia, and this is all about pneumonia in children from me. And let us meet in the next video.